Our co-host, Dr. Nita Landry, is as smart as they come. In this rewind, she answers the gynecological questions you might be too embarrassed to ask. Check it out. And we have Kiana joining us in our audience. So, Kiana, what's your question?
What should I do if I accidentally put in 2 tampons? Should I be contacting a doctor?
That's a great question. So it does happen occasionally. First of all, don't be embarrassed. And as soon as you realize that you have 2 tampons in, you want to get to the restroom and remove them one at a time. When it's time to remove them, you will only need your fingers. So don't use another object to try to hook the tampon and take it out. Remember that your vagina is only about 3 or 4 inches long. So I tell people it's equivalent to a dead-end street. You have the vaginal walls on the end and you have your cervix at the top. There's nowhere for the tampon to go. It's not going to get lost. It's in there. You can find it, okay? So what you're gonna do, right? It's in there. It's in there. It's not that long, okay? So first you can sit on the toilet and bear down. If the tampons come out, great, you're done. If not, you can either sit or stand, take a finger, reach into the vagina, and then try to feel it. If you feel it, take your finger out, go back into the same area with 2 fingers, grab it, pull it out. Okay, if you feel another one in there, do the same thing and pull that one out. But it is important to get them out because when you have more than 1 tampon in there, that means more blood, right? So you have more blood sitting in the vagina and then you can have a buildup of bacteria and that can increase the probability of something called toxic shock syndrome. So you really don't want to just leave tampons in for days and days. And that's why we tell people when they use those super absorbency tampons to change them about every 4 to 6 hours. You definitely don't want to leave one in for more than 8 hours because of the same concept. A lot of blood just hanging out in your vagina, increasing the probability of toxic shock syndrome, which is rare, but it can be life-threatening. So signs you may have a tampon hanging out in there that you forgot about: increased vaginal discharge, a vaginal odor, pelvic or abdominal pain, or some itching. If you say, I don't think it's there, or if you say, you know what, I'm not really trying to check for a tampon that's been in there for 3 days, call your gynecologist. We can take a peek. After about 15 or 20 seconds, we'll tell you whether it's there or not. We do it all the time. Don't be embarrassed, but that's a great question.
Thank you.
You, our viewers, are choosing the topics. It's your chance to...
I've had the skin disease. It hurts and I can't sleep. Is there anything I could do? The good news is
the pressure, the pain, I just can't even function sometimes. I get no relief from any medicines.
Plus, what's the best way to treat dandruff?
People keep throwing oils at it. They're really just fueling the fire.
The doctors